Hello, viewers. In India, we are very fortunate enough that we have more than one medical system to treat the ailments of human body, which are Ayurveda, Allopath, and Homeopath. More often than not, some diseases take not only one approach of treatment, but a combination of all these medical system can come very handy in treating these kind of ailments. We have Dr. Yuvraj Monga from Dr. Monga Clinic with us today to throw more light on this subject. Welcome, Dr. Monga. And my question would be, what is integrated medicine?
Thank you, Prashant. As you mentioned, there are many pathies approved or available in the country. In India, apart from allopath system, Ayush and the Government of Health and Welfare has approved systems like Ayurveda, homeopath, and naturopath. They are legal, statutory approved systems of treating patients, and they are totally three different approaches. Different. They're approved by the Ministry of Ayush, and we have medical colleges, medical schools, doctors practicing these pathogens separately. In India, recently there is a boom in practice of Ayurveda and naturopath. I'm not talking about products. I'm talking about Ayurvedic treatments. So, in many hospitals in the country, very famous hospitals and government hospitals, there are separate departments also. Modern allopathic system and Ayurveda system. Example, in Moolchand in Delhi, Medanta in Gurgaon, they have separate departments where patients are being treated. So, if a treatment is not being managed by an Ayurvedic physician, he or she should refer to allopath. Or if a treatment is not being treated by allopath, they can take the help of Ayurvedic physicians. So this a patient can have both the treatments together simultaneously, which will not affect the, which should not interfere with the results. In fact, improve the outcomes. So combining two pathies for a patient, I think this approach is coined as integrated medicine. You can have two or three things. Even yoga or meditation can be taken as a treatment. So we can integrate this into a system, and one or other pathy should encourage the treatments.
So, at Dr. Monga Medical Clinic, what is your approach in practicing integrated medicine?
There are two aspects. One is referring. If a patient comes to our clinic and suppose the patient is of severe cervical disorder or lumbar spinal disorder, but there is a bulge in the spine, there is spondylolisthesis, and there is a disorder which needs neurosurgery opinion. So we refer the patient to a neurosurgeon. It needs surgery. We cannot manage it with medicines or exercise. So referring a patient is very important to other. Maybe it is come for, I'm a modern guy, I'm MD, MBBS MD. I was an Ayurvedic doctor. If you are not able to help with them yoga or some oil or some Ayurvedic drugs, it is better if it requires surgical intervention. We refer the patient. We don't hesitate. It is a patient of severe cardiac arrest coming to us, or severe, epilepsy patient. We can't treat it. We tell them, please go to a neurologist. Or a disease which we cannot manage by ourselves, to referring. Number one. Number two, we give. I am a MBBS doctor. A patient come to me, or surgeon is referring to us. A piles patient with bleeding piles is requiring, is not suitable for surgery, or does not want a surgery. He can be given Ayurvedic treatment for piles. Patient suffering with constipation, last 10 years is struggling. He can be managed with diet. He can be managed with Ayurvedic drugs like Trifla, Abhinishta. So I refer my patients of constipation, piles to my wife. Please take your opinion. In diabetes, a patient, they're on some allopathic drugs, they're in taking metformin. They want to reduce the dose, or they want to get rid of medicines. So we give them dietary guidance. We put on Ayurvedic drugs like Chandraba Bhatti, Madhunashni Bhatti, but that is done by my Ayurvedic doctors. So at Monga Clinic, we have combined allopathic doctors and Ayurvedic treatment doctors. Both the prescriptions are separate, and same patient can have both the treatments together. So they can have benefit of both. The side effects of modern drugs can be reduced. The total dose can be reduced. The blood levels can be monitored, example diabetes. Piles can be treated. In 2 to 3 months, patient is totally off the symptoms. No pain, no bleeding, nothing. So an Ayurvedic doctor cannot, if not able to manage patients, should refer to allopathic doctors. What is the harm if allopathic doctors prescribe him isabgol, trifla, and all send him to an Ayurvedic physician for treat diseases like skin diseases or sometimes like diabetes, piles, chronic cold and cough, which can be managed well with Ayurveda. So the harmony, coexistence of all the pathies together can be used for the benefit of mankind.
Wonderful.
That should be done. I should be encouraged, and the ministries, the doctors should try to find a platform where this can be encouraged in a legal manner.
Wonderful.
Yeah, this is what my objective is.
Thank you, Dr. Monga. So, viewers, you have just listened to Dr. Monga about integrated medicines, and what a wonderful thought it is that the whole idea behind integrated medicine is to pass on the maximum benefit to the patients, and that is what doctors are all about. So, we will see you next time with a more informative videos. Thank you so much for being with us. Thank you.